addiction can happen to anyone. That's the same old saying you hear everywhere with anything regarding addiction. What you often don't hear is how or why addiction can happen in any person's life. First, let's understand what addiction is. Addiction is defined as a chronic relapsing disease that is characterized by compulsive drug-seeking behaviors despite the harmful consequences they may come with. Struggling with addiction is not a matter of being weak. It is not willpower-based. There are a variety of reasons that people struggle with recovery and relapse. Intense withdrawal symptoms and cravings drive relapse, not to mention the stigma around those with substance use disorders. Shame and guilt play a large role. As people struggle with substances and require help, too often they are discouraged in getting needed help. Those struggling with addiction need support to recover. It is that simple. Not everyone who uses substances becomes addicted to those substances. There are some key factors which can lead to addictive disorders. Knowing how addiction happens can help with avoiding dangerous situations and help better understand a loved one's actions. The risk factors for addiction include your environment. The people you are around and the place you live can impact development of issues with drinking or drug use. Your biological makeup, your parental history of alcoholism or drug dependence. Beginning drug use or drinking when you are young. Mental health disorders. A peer group that normalizes use of drugs or alcohol. It is important to keep in mind, even with none of these risks being present, that addiction can still occur. On top of the factors that place people at an increased risk of addiction, there are also some key signs of addiction to look out for. Changing friends often. Poor personal hygiene. Having problems at work or school. Losing interest in their favorite things. Having problems in personal relationships. Mood swings. Sleeping at strange hours. Spending a lot of time alone. Eating more or less than usual. Or having a sudden need for money. Although there can be other reasons for these signs to appear, a convergence of several at once can be a warning sign. It is crucial to get help as soon as you notice the signs of addiction developing in a loved one. If you notice the signs of addiction, how do you get help? Here at Find Addiction Rehabs, we help people struggling with alcohol and drug abuse find the best rehab centers in the U.S. We have a wide selection of treatment centers and detox facilities to choose from. There isn't a single cure or solution that gets rid of addiction as a disease. However, a substance use disorder can be effectively treated. Two key forms of treatments used at many addiction treatment centers are behavioral therapy and pharmacotherapy. Behavioral therapy helps identify destructive behaviors to help you better understand why using drugs and drinking are so attractive. Pharmacotherapy helps manage withdrawals as well as treat the underlying mental distress that often accompanies addiction. These forms of therapy also help allow people to lead a more stable and satisfying life overall. All alcohol and drug treatment at an accredited facility is catered towards an individual and their needs in recovery. Every person has a unique history and set of needs that must be met on their path to recovery. If you or a loved one are struggling with addiction, let Find Addiction Rehabs match you to a facility that meets your needs and start on your road to recovery with us today.